All right. So for the duration of the webinar, everyone who is a participant will be muted, and you'll be able to interact with the panelists using the webinar chat feature, which I believe is located at the bottom of your screen. If any of you are having any technical, you can reach out to Wendy Richter via email. You should have received an email yesterday with her email address, but it's wendy@lakecountycf.org if you have any trouble. And if you're having trouble accessing the slide deck, I've been told that accessing from the browser option works really well, so you can use that in order to access the slide deck. So good morning and welcome to the Lake County Community Foundation's first webinar. As this is our first webinar, please bear with us if we do have any technical difficulties. This is definitely a learning process for all of us. We're so excited. We have about 65 of you who have signed in, so thank you so much for your interest in this topic. My name is Maggie Morales. I'm the Foundation's Manager of Community Engagement, and I oversee our strategic grant making and community leadership activities. Today's webinar builds from the Foundation's recent event that was held on January 23rd. Many of you were in attendance 3 weeks ago. For those who were not, here's a little bit of a background as to how this webinar came about. So on January 23rd, we brought together over 150 individuals to discuss suburban poverty in Lake County. The group was comprised of local philanthropists, family foundations, business and nonprofit executives, concerned residents, leaders from faith-based institutions, education, and more. Dr. Scott Allard joined us to share information from his latest book, Places in Need, The Changing Geography of Poverty. Scott is a professor at the Evans School of Public Policy and Governance at the University of Washington in Seattle. And prior to that, he was a professor at the University of Chicago, where his research led him to explore issues facing Lake County residents and their families. He has interviewed a number of our Lake County nonprofit agencies and has remained a committed partner and advocate of the Community Foundation and Lake County's nonprofit sector. So we're very pleased to have him joining us again today. Scott's remarks, in addition to the information that was shared by all of our panelists, sparked numerous questions from participants, many of which we hope to answer today. So before we dive in, I have a few housekeeping issues to share. As you can see, today's session will address questions from last month's event as well as today. So if you would like to pose a question again, please use that chat feature that's found at the bottom of your computer screen. You may need to hover over it in order to pull it up. A recording of today's discussion will be made available following the event. And we will begin with a handful of questions that were shared during last month's audience Q&A, but please feel free to ask questions throughout the duration of today's webinar. We'll do our best to get to as many of them as possible. So in addition to Scott, I'm joined by three of my colleagues, Sean, Jael, and Brenda. And here's a little bio about each of them. Sean Collins is the Community Health Specialist with Lake County Health Department's Health Equity Team. He's worked for the Health Department for 28 years and has served as a community health educator, counselor, and member of the organization's Health Equity Team. He is a co-chair for Live Well Lake County's Be Active Walking Action Team, where he and several community partners have been working diligently to empower Lake County residents to improve their health through the simple act of walking. Sean is also a member of Connect North Chicago's Community Advisory Group. He sits on North Chicago Counts, which is a coalition that promotes drug-free communities. Next, we have Jael Mejia. Jael is the Engaged Citizens Program Manager at Mano a Mano Family Resource Center in Round Lake. She's worked there now for the last 4 years and currently oversees the Immigration Legal Services and Adult Education programs. As a Board of Immigration Appeals representative, Jael and her team serve hundreds of individuals and families every year by providing assistance with citizenship and naturalization, replacement and renewal of legal permanent residence, initial and renewal applications for DACA and temporary protected status. And lastly, we have with us today Brenda O'Connell, who's the Continuum of Care Program Coordinator for Lake County Community Development Division. Brenda oversees federal funding to support our community service providers serving individuals and families experiencing homelessness. This has included efforts to end both chronic and veteran homelessness throughout Lake County. In addition to staffing the Coalition for the Homeless, Brenda serves as a member of the Board of the Alliance for Human Services. So now, to help us frame today's discussion, Scott is going to share some of the key takeaways and recommendations that emerged from his work and his most recent book, Places in Need. Scott?
Well, thanks for everybody for logging in and being with us today. Thanks to Maggie and Wendy and Lake County Community Foundation for putting this together. It's fun to continue to have the conversation. I think we all felt that the time went by really fast when we were all together a few weeks ago. So this is a nice opportunity to have continued dialogue, and I hope that those of you who have questions can throw them up in the chat window, and the team here will do our best to answer them. When I finished up in my remarks a few weeks ago, this was, I think, the last slide that I put up, and these pathways ahead relate to some of the findings from the book, some of the demographic realities that we're familiar with in Lake County, and then some of the consequences for the safety net. I think I tried to make an argument that we need to fight against the stereotypes of poverty that exist in our communities and the perception gaps that exist, which not only create inaccurate impressions of low-income families in our communities, but also the reasons why people become in need of safety net or help or other support services. And just encourage the audience to think about those issues. In addition, we talked about different kind of responses the safety net has, and so I talked about making sure we support public programs, and particularly programs that we know are effective at reducing poverty and resisting efforts to reduce eligibility or to retrench programs or remove really valuable or important assistance from families in need. Apart from our public responsibilities, we have private responsibilities, I think, and I think many of us see that, and we see that in our work and our volunteerism. But I think we need to make a case for greater private giving and even more volunteerism, particularly in suburban areas where there isn't as much nonprofit capacity or as many nonprofit resources as you might see in urban centers. We give less than 1 out of every $10 of our charitable giving as a country to causes that work with low-income populations broadly. And if we're going to really tackle the needs of our communities, we're going to have to generate more and new revenue and not just expect that we can reallocate what we have currently to cities out to suburbs. As you may remember, urban poverty hasn't gone away in the window that we're talking about here. Important to that are communities of faith, not just as places to volunteer and engage, but to build awareness, to help link people to resources. And we spoke extensively about how communities of faith are really trusted partners and important resources in all communities, urban, rural, and suburban. And we spoke about how we can train the next generation of leaders, and I think that's a piece actually for all the panelists rests kind of close to our goals and objectives for our own work, but making sure that we're identifying Indigenous leaders in our community who understand the needs of families and neighborhoods and can help support them as they find their path, whether it's through elected office or in nonprofit service or even in nonprofit leadership or government agency leadership. And then in the end, I think, we talked about choosing a shared fate, and I spent time talking about the competitive pressures that exist between cities and suburbs and the need for both cities and suburbs to work together. Part of that's thinking about our shared fate as suburban regions as well. There are real competitive pressures that shape and guide how we formulate policy, and there's often concern that if we reach out and do more for low-income communities or disadvantaged families, that we might end up attracting more of those families, or we might damage our business climate somehow. The evidence of those kind of presumptions is there's not much evidence, if any, that's what happens when we support low-income families. Yet the issues of NIMBYism or not in my backyard kind of persist, where communities are hesitant often to create new programs or to allow nonprofits to enter in to their community with new services or programming because they're worried again about creating a negative image or negative impression. The most important thing to realize is that poverty is present in all our communities, even the most affluent communities, whether we admit it or not. And by not choosing a shared fate within our regions and overcoming some of these competitive pressures, we're actually going to undermine our ability to address poverty in any part of our suburban region. And ultimately, it'll be to the detriment of the entire community and the opportunities in the community, and not just one place where we perceive poverty to be most present. So with that, I think we probably want to shift to questions, because I think I talked a lot the last time. So it's probably time for me to stop talking.
Okay, well, thank you very much for kind of framing out the conversation. And I appreciate you mentioning NIMBYism, because that's one of the questions that members of our audience had at the January event. So this is for all of the panelists to feel free to address. So one of Dr. Allard's slides, which you can see on the deck below, reference NIMBYism. Please address how NIMBYism impacts your work and Lake County as a whole.
Do you want me to start with this one, or does someone want to jump in?
Yeah, Scott, if you'd like to start and maybe further address what NIMBYism is, that would be really helpful.
Yeah, as I mentioned, NIMBYism NIMBY is an acronym for Not in My Backyard, and we use it to talk about a variety of different challenges that communities face as they address issues of inequality and inclusion and social justice. In my neighborhood here in Seattle, we're having conversations about housing density and construction of more high-rise affordable housing. And there's a lot of people in the neighborhood who are supportive of that, but there's a lot of people in the neighborhood who don't want that in their backyard, so to speak, and are resisting city planning efforts to do so. So this is common. It happens in cities. It happens everywhere. It doesn't help us address the problems in our community, though. And I think it also underscores that the need to have a kind of a sense of shared fate, that we all have something at stake in addressing problems of inequality or poverty. I have lots of examples from my studies. I think the one that's most powerful, and this actually comes from a Chicago suburban region, was there was a school that I spent time talking to a couple people who are connected to this particular school, and they had started a food pantry for families in the school because of the rising number of students who were coming to school without an adequate diet. Recognizing that a lot of the families were working but just not earning enough, and they were skimping on food as they tried to make ends meet in other areas. And the food pantry was really, really successful. Lots of families came out. It provided a lot of important food to kids, and I think the school thought it was great. But the demand was high, and so when the days of the food pantry, families would line up outside the school and then down the block. And this particular school official related to me that they engaged with a local government official who came by and saw the line and said, what's going on? Why do we have this here? These aren't our people. These aren't people from our community. We can't give people the impression that we have people like this in our community. And the school official kind of pointed out that these are the families of our children in our schools. This isn't, somebody else's problem. This is the reality in our community. These are the families we need to serve. And I think that kind of episode I saw in community after community. You see it in cities as you do in suburbs, but I think it's particularly prominent in suburbs where we have this perception that poverty problems don't affect all our neighborhoods or all our communities, or where they do, they're somebody else's responsibility.
Mm-hmm. Good morning. This is Brenda. I wanted to chime in here as well. In my work at Lake County in the community development work group, I see community members getting involved in public discussions about where services are located. In fact, our strategic plan for funding specifically calls for the placement of affordable housing in high opportunity areas, which can spark some big community conversations. That public process is a part of transparent, open conversation and a critical part of the process. But I feel like that shared sense of faith that Dr. Allard is talking about is critical to keeping the conversations productive. As hopefully, in an ideal world, with keeping the shared sense of faith at the forefront, the community can be educated about what the needs are of the community, their neighbors' need, and the overall community benefit of having affordable housing, especially in high opportunity areas. And ideally, the community will listen and help to problem solve about how to locate services throughout the county in a way that's equitable and responds to where the need is.
Yeah, hi, this is Sean from Lake County Health Department. I think with some of the work that we're doing on our health equity team, some of the things that we want to try and address as far as, this whole not in my backyard concept, fast food restaurants, this is something that, we see in, neighborhoods, obviously, that are depressed economically. Liquor stores, they're almost on every corner in some of our neighborhoods. And then probably the one that we really want to try and address more is some of these storefront gambling sites that popped up all over Lake County or all over some parts in Lake County. And again, some of our environments that are more vulnerable. You don't see these type of things, these type of sites in more affluent communities in Lake County, but it's just so much easier to put them in some of these depressed locations. And a lot of times we look at it, we're looking at these communities on the governmental level, looking at revenue. That's always one that they kind of go to first, is increasing revenue. But when you have every other building that's a liquor store, a fast food restaurant, and there's nothing to combat that with on the healthier side, and then it just adds to the already going economic depression that's in those type of communities. I think the perception of some of these communities also of these type of entities in these communities need to be looked at as well. Again, mental health facilities, we need them, but you got to look at where they're located at in some of these communities. Waste dump or waste disposal sites. Think about where some of these sites are located and not in other communities. Some of the safety net facilities, Scott mentioned a little bit about that a few minutes ago, but you see in Lake County, Social Security offices, public aid facilities, they're located in certain communities and not in others. And the same thing goes with subsidized housing as well. So our perception of some of this is we need to take a look at, within our own selves and how that perception affects our thought and what we think about people who are poor. But also looking at addressing that if, we're going to have, some of these places, that are more unhealthy or whatever, can we combat that with something that's more healthy or that can actually give a choice, a healthier choice for people?
Yeah, that's a great point, Sean. Thank you. Cheryl, did you want to share?
Yeah. So one of the things that I connect with Brenda and Sean in this is that you both have the same topic of education. And I think for the work that we do, that's the same thing, because there are just so many misconceptions tied to the work of immigration that we do. And NIMBYism is definitely one of the things that affects the work that we try to do the most. Although immigration recently is the most talked about topic, most people who have the capacity to actually raise the issue do not feel like it actually impacts them because it doesn't affect them directly. But immigration is so much more than dealing with undocumented individuals or security. It really impacts our communities, our economy, and basically the well-being of our entire country as a whole. So there's a lack of understanding of how much our immigrant communities contribute to our country, and there's so many misconceptions that are tied to immigrants. So, people who live here their entire lives, raise their families, contribute the same as any other native-born person does, are treated as second-class citizens simply because of this label that they have due to their legal status or lack of, or even the perception of their legal status. And basically, the broken immigration system that we have creates a whole new set of problems to address. which continue to marginalize the already vulnerable communities. And so it's definitely a big issue for all of us, but very few people believe that it's an issue that affects them. And one of the other things that we can see about NIMBYism in Lake County, it's very clearly evidenced by the residential segregation across communities, which is mostly by economic divisions, but it's also reflective of the divisions in race and ethnicity. And so this like socioeconomic segregation continues to create this continued limited understanding of social economic challenges faced by some communities, because some other wealthier communities don't face the same challenges and cannot understand and connect as they never leave like the areas that they're from. These wealthier communities don't really realize that literally in their backyard, other communities are faced with so many other more difficult issues than they can ever imagine. Yeah. So education, I think, is the most important.
One of the things that strikes me is when I listen to the panelists talk, and this was true when we were all together a few weeks ago, is we have this presumption that the challenges we face in our communities are being brought into our communities from outside. That's part of the reason why NIMBYism has its power. There's this kind of threat of the other or the outsider. But as all of the panelists can talk about, the families that we're trying to work with in our communities and the families that we want to help achieve greater well-being and greater mobility, the vast majority of them have been living in our communities for a long time. And so this sense that there are these threats from the outside, which is a common rhetoric, is just not true. I think the other thing that jumps out at me here, it's so important to consider how all types of policy processes shape the communities around us, whether it's zoning decisions or who gets licenses or where we locate offices or things like that. And those decisions matter a lot, but often the voices of many communities are not heard in those decisions. And it underscores the importance, as we noted before, of cultivating a new generation of leaders and making sure that they're engaged in the policymaking processes that shape their communities.
That's a really good point. We have a follow-up question from one of our participants. She asks, how is the county utilizing community health workers to help tackle this issue of NIMBYism?
John, this sounds like one for you.
My wheels are turning as we're speaking. I think that we have quite a few, and I'm very kind of limited on a lot of the work that we do, because we have a lot of people doing a lot of wonderful things for the health department in the community. But we do have a lot of employees that are very much in the trenches, are very much engaged. Like I mentioned too at the last time we met at Lake Forest Hospital. A lot of these workers are from these communities, and a lot of these workers, they're vested just like a lot of us. And so if you look like the community that you work with, you can build that rapport, that relationship. But, so whether it's some of our home health nurses, our case managers, they're right in the trenches with these people. And I think that's a service. I think that's something that we, as the Lake County Health Department, that we can pat ourselves on the back for. We're going, so a lot of us like to think that's just our job, but in a lot of ways it's going above and beyond that as well. So it's meeting them where they are, where our residents are, but it's giving them that personalized support as well.
Yeah, and sorry, this is JL. So if I can speak a little bit to that, Mano a Mano actually has a program with community health workers that we started for the same reason, because the community that we work with is not very familiar with the healthcare system. They're not really familiar of how to access healthcare services, and we found that it was very crucial to have people from the same community that are trusted in the community to basically connect with these individuals. And so it has been a very successful program in that sense, because we also take in consideration how people perceive certain things and cultural ways that you have to, connect with people. And so a lot of times, at least in the Latino culture, you don't really talk about different health topics out in the open. And so when you have small groups with family members only present, these intimate conversations about important topics, whether it's diabetes, which is prominent in our communities, or, breast cancer awareness, things like that. We have had a lot of success with people identifying some of these issues and actually accessing medical care at an appropriate time.
Yeah, and I think as well, we as an agency, and I think any agency, you also have to know kind of your limitations and your capacity level and how you can help address this as well. So, one of the things that we're kind of focused on now is building some of that capacity. Trying to network with other programs, other organizations that can do some of this community work as well, and working with their health workers. So. Although I'm gonna pat ourselves on the back here, we do a great job, but we want to partner where we can and actually try to expand services to the residents in the community.
Hey, Brenda, I have a question. How do you, in your work in the county, how do you, as a leader and a manager, kind of encourage your staff to give you heads up on things that they're seeing in the community, and how can you give us some tips on how good leadership practice would facilitate workers to kind of help be kind of proactive voices of change and progress?
Sure. I think that the work that I do with the coalition and the alliance, where nonprofit organizations are sort of coming together and learning about sort of the data about what does our community look like? What are the needs of our community? What are the realities in our community? What are the different ways that we're responding to that? I think that those educational opportunities can be great for sort of anointing advocates in the community, so that they're better armed with information. We operate in the human services arena. We operate in a highly technical world sometimes, where you're impacted by local government, county government, and state government, and federal government, all of which have changing rules, changing laws, budgets that are either on or off, or non-existent, or change from day to day, and it's very hard to keep up. So I think that those opportunities for alliances and coalitions are really important for increasing capacity and helping us speak on the same page or from the same book.
Mm-hmm. And we had a follow-up question to what Brenda's been speaking about. So Jessica again asks, how are they reporting their findings, and do those groups have their own boards? Do you want to speak to that from your experience with the different coalitions and your own organization, Brenda?
Sure. The Lake County Coalition for the Homeless has a board of directors, and it is a membership organization, so it's individuals can join, but it primarily are agencies that work with clients that are homeless, if not exclusively, at least partially, and maybe some government entities that are also interested in the issue. The Alliance is much the same. It's a membership organization open to all human service organizations. Also, interested friends can join, and individuals can join as well in certain circumstances. And they also have a board of directors that's elected by the membership every year. So those, I don't know about reporting their findings. I think that the convenings are opportunities to come and learn more about what's going on. And they're always looking for ways to bring the most relevant and helpful topics to the membership.
From the Community Foundation's vantage point, I think one thing that we've observed is there's a wealth of really valuable information present in our community, and a lot of partners are unaware that that information already exists. So quite frequently, we have situations where people are wanting to commission reports or have somebody from the outside come in and do some research on something that we already have pretty robust data on. So one of the goals that we have as a community foundation is to help kind of serve as a repository for that information, but it definitely is it takes a unified effort to be able to do that, to maintain it and to be aware of what is available, and then, you know, to be able to house it and push it back into the community so that it can be beneficially consumed by all of our stakeholders. So shall we move along to another question?
Sounds great.
This next question is for Jael, and this again was an audience question from our event. What are the poverty implications for children and families led by undocumented parents who don't qualify for many of the safety net programs?
Yeah, thank you so much for that question. I think it's very, very important to talk about that. Basically, immigration status is directly connected with the quality of life an individual has. And this is the same for children of parents who are undocumented. They face the same hardships that their parents are going through. And because the parents don't qualify for safety net programs, they often assume that the children don't either. Or sometimes they're even afraid of seeking benefits because there might be some negative repercussion with immigration or things like that. And this comes back to the lack of understanding our system and not enough providers to be able to guide them through all of these issues. Undocumented families also struggle to have a stable job and income, which limit their access to success and even the entire family's future. Obviously, children learn healthy habits from their parents, and so situations where the parents are not fully integrated into, for example, the healthcare system and don't regularly access preventative care, these habits are also passed down to their children, where, you know, in long term, they will continue to have these habits that are not the best. And then this also goes back a little bit into the conversation we had about socioeconomic segregation, because these kids tend to be part of communities in Lake County that have districts, for example, that there are the majority of the students are people of color. So like Waukegan, for example, North Chicago, Zion, Round Lake. These districts also tend to be districts that have like the worst outcomes, crumbling buildings, high teacher turnover, and lower funds per student. So not only does this concentrate the challenges, but it also can lead to supporting these cycles of poverty. You know, the generations of the same family who over time continued in poverty, and students who basically are from these communities and schools with limited resources, it's really hard for them to actually find a better life as adult, because getting out of poverty is all about access to opportunity. So if there is no access to opportunity and everyone's just segregated into these areas with no resources available to them, it just continues this cycle of poverty, regardless of their immigration status.
And Jael, can you speak to how Mano a Mano has effectively employed its strategy of going out into the communities to really meet those families where they're located and to connect them with different access points for service?
Yeah, definitely. We try to do, it's similar, I guess, to the community health workers. We try to go out and do information sessions throughout the community so that we're not waiting for them to come to us. We have built a lot of trust in the areas that we've been serving our community. And so we are approached, but we don't wait for them to necessarily come and ask us about the recent changes in immigration or what this means to them. We go out and we do presentations to different areas in the community. We try to partner with schools, libraries, anywhere where community members gather and bring the information to them. And, you know, especially immigration, this is some topic that no one's going to come out and say, you know, I'm in this situation. I don't have status, or I don't know how to obtain the best status. And so we try to do broad, generalized presentations so that people who hear this might not necessarily approach at that moment, but know where the resources are. And so at the end of the day, our program basically focuses on helping people obtain the best legal status they can have. Everyone that comes through our door has a full legal screening. Because our immigration system is so complex and it really varies per individual, we really focus on analyzing this person's specific case and try to identify what the best way for them to adjust their status is. If they have an avenue, we provide them the resources or referrals to the place that can help them if that's not us. But if they don't, we also provide them information on fraud prevention and, you know, what they should know in order to keep themselves safe from people out there in the community who are trying to take advantage of people's vulnerability, and frankly, they know that people are desperate. And so that's a whole other aspect of the work that we do.
Thank you, Jael.
Yeah, and Maggie, real quick, if I can mention real quickly, the health department is one of the safety net provider who does serve people regardless of the documentation status as well.
Mm-hmm. Right, and it's definitely important for us to have partners like you, because we then have resources available to those who need it.
Mm-hmm. Yes, I agree. Mm-hmm.
I think that our community has done a really nice job of connecting families who are in very vulnerable situations to the resources that are available. I think there's still plenty more work to be done, and I think this particular issue really speaks to what Scott was referencing earlier about the importance of having that shared fate and how it really impacts the ability to affect policy change. So, are there any, we do have another, go ahead, Scott, sorry.
I was just going to say, I think it's really important to underscore, the work that Mano a Mano and other organizations do with immigrant families is important. It's that they're very good at it. It's important to recognize that a lot of their success, it hinges on having communities around them that are supportive of the work. And I know when I was in the field, you could find lots of organizations that had missions similar to Mano a Mano, and maybe not this high quality staff and leadership, but we're struggling because the communities around them were not supportive of the work or the mission. And it forces them either to kind of go on the down low with their work or maybe out of business altogether. And so having providers is really critical, but also having political leadership and local civic leadership that is willing to support the work of these organizations, it really matters, because otherwise it's really easy for anti-immigrant sentiment to kind of shut out or shut down this kind of work. And that's not to take away anything from Mano a Mano or the community health department on this. They do great work, but it's important to recognize that we have to have local support in other areas to help those organizations do that very important work and reach those particularly vulnerable or isolated populations.
Absolutely. I think that's a tremendous opportunity that we as a sector have to really connect to our local officials in providing that advocacy, and just continuing to educate other communities about the importance of this work and the importance of being inclusive and supporting all members of your community.
Yeah. Maggie, also real quick, I just want to mention too, and Scott mentioned this earlier, but I just wanted to speak to the point of, he talked about, also the community engagement part, getting the residents and getting them aware and involved. I think that plays a major role in this as well, because a lot of them don't know. They feel powerless. They just kind of leave it up to outsiders or people to come in and change and fix things, when they just need to be told or realize that, they have the power themselves. And so they just needed to be supported in that, but they also need to know, what does that mean and how do they get to that point? And because a lot of them don't have an idea. They just, they rely upon like I said, elected officials and everyone else. But I think that has to come also from them as well. Because I think that's one of the major issues that we're having in some of our vulnerable communities in Lake County, is just getting them involved, getting them, engaged. I personally, I know the community where I'm from, and, you have elected officials who, are aldermen, and they'll win their election by, they only receive 30 votes, in their ward, and that's it. I mean, we have to get more engaged, get them more engaged in this as well.
Mm-hmm. Yeah, I mean, I think we are talking about something very important here, and I love both of your comments because at this point, if we think about how Mano a Mano was founded, it's very important to see now, how many years after we're still successful, but we were founded by the then chief of police at the time and the mayor at the time, who none of them were immigrants, but they were able to understand that their community was changing and that they needed to do something to respond. They were committed to making sure that the immigrant families felt like they were part of the community. So this is very important. I think we're going to talk a little bit more about that, but we have to keep in mind that these issues that are faced by the communities, the immigrant community, or, people who are suffering in poverty, cannot be fixed just by the community that is struggling. It has to be a work that is between everyone and a cooperation between everyone, because we all are affected one way or another.
Yeah. Thank you. I think you can all tell that we could go over these questions and talk about one question for the entire session, but there were so many fantastic questions that the audience shared and that I know you all have. Let's move along to another question. The next one is for Sean. Let me pull up the slide here. Oops, I'm sorry. The next one is for Scott. Excuse me. And this is actually a question that's for,
well, we kind of look alike. So
yeah, we go to the same bar.
So, Scott, can you please speak to the impact of disability on poverty? And the person who posed this question referenced both physical and non-visible disabilities. What have you seen in your work in terms of studies on the pipeline of special needs children who are aging out of school systems and maybe don't have the needed support services or structure in place once they've aged out of school? What does that look like to you? What have you seen?
Yeah, this is another really critical area for us to think about, and I encourage the panel to kick in here, because I have a feeling that families struggling with the challenges that disability poses are present in all their systems, and we all connect to them in different ways. I think we know that families, whether it's adults with disabilities that limit work opportunity, or adults that are caring for children, or elder adults with disabilities, we know that those families are more at risk to being in poverty, or to being low income, or to being an illness or a challenge away from losing a job. One of the realities is a lot of the programs on which that we serve adults and kids with special needs or with disabilities are on the chopping block right now in Washington. And so thinking about how we can be good advocates locally within the state, but also with our elected officials, is really critical. From a geography standpoint, I think one of the things that I saw in my work, and I don't talk enough about this in the book, but Sean, I think, kind of mentioned this before. The services are located in suburban communities for a variety of reasons, but they're not always really accessible to the entire suburban region or county. You have to locate where there are economies of scale, or where the political winds allow you to. And for families struggling with disability, it can be really difficult to get from one end of a county or region to another, to juggle all the complicated commutes that one might have. And so it's not unusual for families to be, many, many miles away from programs of assistance. It's also not unusual in more remote suburbs to have no programming at all that's helpful or relevant to families with disability. I know when I spoke to people in the child welfare system, there's also challenges of kids aging out of the child welfare system. That's a little different than kids with special needs, aging, kind of aging out of school. But the issues are the same. Again, there are not always providers that do the work, and a lot of the funding for these programs, or a lot of the coverage for these programs, comes from Medicaid, and yet we know that that there's a lot of interest in Washington right now in limiting access to Medicaid, cutting it back, making it harder to stay on. When this is a program that's helping a variety of families, most of them most of them facing considerable challenges to work. It's a program that provides critical access to assistance. But I'd welcome the others to talk about how they see these issues present in their clients and in the work they do.
Mm-hmm. This is Brenda. I can speak to one specific local response because the questioner asked about local response. In Lake County, we have recently decided to start an initiative to address specifically people who are homeless with mental illness and who are trying to access federal disability benefits, so SSI and SSDI. Nationally, the data on the approval rates for people trying to access kind of a tough system to get through, rightfully so, because if you are approved, you get benefits every month. So the government wants to make sure you're really disabled, but when you are not stably housed and have a serious mental illness, the chances of you getting approved, even if you are very eligible and in need of that resource, are around 10%, just horrible. And so we have been working for about 6 months. We were selected through a technical assistance grant to implement a national best practice called SOAR, where we can train case managers on the disability approval process and help case managers to get people through that process more successfully and more quickly. Mm-hmm. And unfortunately, it doesn't actually pull them out of poverty because the amount of money that's received through disability, I think, is still below the federal poverty line. Mm-hmm. But it's enough money that those people can often not be homeless anymore. It's enough stable monthly income that they can secure housing and their basic needs. And so we've been doing that for about 6 months. We've trained over a dozen caseworkers on doing that. We're starting to see applications to our local Waukegan Social Security office go through, and we've established partnerships with them. And so that's a way to really talk about the most vulnerable people getting access to the response that they're supposed to have access to, but it was a little bit out of reach for them, mm-hmm. and ways that we could work with our community partners to help put that in reach for them.
Yeah, one of the things that we've encountered through our work at the Community Foundation has been that we're seeing nonprofit organizations that are either increasing the capacity of existing programs or establishing new ones in response to this aging out issue. So if you have a population that you're working with that's aging out of the school systems and maybe needs some sort of workforce development opportunities, we've seen nonprofits in the area that are doing a good job providing that. But I think one of the issues that we continue to face in the suburbs is the scalability of those programs relative to the increasing need. And so while it's phenomenal that we have those programs accessible to many of our community members, I think the need continues to outweigh what's able to be provided. So it's something that we have to work through collectively.
Yeah, I think this is a challenging issue because many families in our lower income communities have so many stresses that it's often hard to have time to receive what's needed. For example, for our early intervention program for children with special needs, our community with the lowest participation rate is North Chicago. So even though, the need is probably high, but it's hard to fit the services in if mom is working 2 or 3 jobs just to put food on the table.
Yeah. That's a great point. So the issue of access, again, is such a huge component to addressing this.
Yeah, well, and also, I think Sean's point here, it's complicated, and my sense is that we could use as many good ideas, from thought leaders in the community about how to better reach families and how to help them navigate. But yeah, the point, your point, Sean, that really hits home. That we shouldn't think of these families as not juggling work and school and all kinds of other stuff. It's really a difficult challenge for them.
Mm-hmm. And I think there are some services out there. I just, this is an example I was going to give when it came to my question, but I'll go ahead and give it now. Our staff recently met with Goodwill of Great Lakes, and what they told us was that they provide employment opportunities for people with disabilities. So we're talking about, again, probably that age group of after high school. They employ approximately about 600 employees with disabilities to work in food service at the Great Lakes Naval Base. They pay them about $10.52 roughly, and for an 8-hour day, and they offer them benefits as well. So there are some, it's just they're far and few in between, and people just need to be aware that they're out there.
Mm-hmm. Yeah, and I mean, this is also definitely an issue in our county because of the transportation. Yeah. Transportation for disabled people is very difficult, at least even in the western part of Lake County, it's even tougher. Mm-hmm. But another thing I wanted to mention too is, there's already difficulty to access these resources. I've seen a lot of young kids who actually are undocumented, who are, arrived here when they were very young, might qualify for DACA, some might not. They have a hard time accessing resources, so getting to us so we can help them file some sort of DACA so they can get work authorization in the first place. Others cannot get work authorization, so this even cuts them off participating in some of these workforce development programs because they need that work authorization, mm-hmm. which is not that easy for them to have, or might not even give them the opportunity to ever have. And so these kids are basically just left behind and do not have access to any resources at all. Mm-hmm. So that's another aspect of additional how someone's immigration status basically limits any of their possibilities to improve their lives, mm-hmm. even more if you're disabled.
Yeah. Thank you. All right, let's move on to another question. Lots of questions for Brenda. So Lake County does not have a Department of Human Services. Given the immense fragmentation of governments and nonprofits serving the poor, who should or does collect data about poverty in the county?
Sure. So my first response was that the county delivers a lot of human services through the health department, which is a federally qualified health center, through workforce development, which offers job training, Veterans Assistance Commission, which offers a lot of human services for veterans. So there are human services that are delivered through the county system, just not with the name Department of Human mm-hmm. Services. So I think, to circle back to Maggie's point earlier, there's a lot of data mm-hmm. about poverty in the county. The health department has a data and publications tab that allows you to even filter and drill down on some of the data that they have. The Community Foundation has a tab that collects a lot of the research and studies that have been commissioned over time that are really informative and local. And additionally, every year, the Social Impact Research Center of Heartland Alliance, I actually think someone from there sat at our table uh-huh. at the event, puts out an annual poverty report that drills down to the county level, and then overall for the state picks themes each year around racial inequality or trauma or violence and those kinds of issues as well. So there's a lot of data at that level that's really helpful. And then I'm going to talk about Service Point next, so I won't talk about it right now.
Okay. Okay, thank you. I think one of the areas though where we do struggle a bit is the really hyper local data. So if you're looking for data about a particular neighborhood in a specific municipality, or even sometimes at the municipal level, it can be challenging for a variety of reasons to gather data that is statistically relevant and also comprehensive. So I think we've got more to do, but I think we do a good job with what we are able to have available. So
Dr. Allard makes a point at the end of the book about advocating for the American Community Survey and its importance. And it wasn't until I read that in the book that I thought, oh no, that could not exist. And thinking about my world without that existing was very scary.
Yeah.
So I'm glad that was in the book.
Yeah.
Yeah. The census has been under attack in Washington for most of the last, 4 or 5 years. Not enough funding, not enough leadership. And, the census is just critical, way beyond thinking about poverty figures. I mean, the census is such a critical resource for our country and for businesses and nonprofits. Doing that well really matters. It's just shocking that it's become a partisan issue and a political issue to me. It just doesn't make any sense. I would say one thing about the data piece, it's important to keep in mind that when you pull data that's at the local level, you can get all kinds of data from the Census Bureau, but the 1 year data you get is at a higher level of geography. So for instance, if you wanted to get data on like 2016 or 2017, you could get it at the county level or maybe at some larger municipal levels. There's more data available to municipalities over 20, 30, 40,000 and in 3-year chunks from the American Community Survey. But those are aggregated over 3 years. But the best data for really kind of micro level, neighborhood level work is the 5-year data. And that data is, again, it's collected over a 5-year sampling window. So it kind of averages, people from 5 years ago with people today. And it's better than the snapshot data we used to get, which was every 10 years, but it's still limited. I do know, though, that the 1 year and 3 year data is really noisy once you start to get to like smaller levels of geography. And so I always caution people about using different data products, because you can get really funky short-term results because it's the natures of the samples as they compile them over time. That's a little inside baseball, perhaps.
Thank you. That's helpful.
The next question says, does Seattle have a regional government? I've been thinking about this question a lot, actually. So one of the things that I think when scholars and policymakers get together to talk about poverty outside of cities, we often talk about the importance of building regional governance structures and regionalism. And I think that that's true. I think that there are real limits in how that can be done, just given the political and demographic realities of our communities. It's not a bad goal to hold out for, but I don't know if we can wait for regional government structures to be created to tackle these problems. Where you see regional governance most effective, it's often around transportation or housing, where there's a metropolitan governance structure that collects and allocates resources across a metro area with a strategic plan. In Minneapolis, St. Paul, where I'm from, there's a Metro Transit Council that does that. I think they also do housing work that way. It's not without its controversies, though, because everybody feels like they're paying too much and not getting enough, or their preferences aren't high enough on the priority list. It can be really, really difficult. In many ways, in Lake County, you have a regional government. You have the county. But the powers of the county are really limited in dealing with poverty issues, in that there's a whole set of other actors that have to be on board for the county to pursue anything, even if they were willing to dedicate lots of resources to it. I think it's really hard, though, to look out there and say, here's a regional government, a regional governance structure that's successfully tackled poverty. I don't think you see it. What I think you see are foundations like Lake Community Foundation that do a good job. You see county agencies like the Department of Health or Community Development that do a good job. You see nonprofit organizations like Mano a Mano and others that have a regional reach. Those are the success models I see, or at the local level. But it's really hard to to think about how we would get to a regional structure that would tackle poverty problems.
Mm-hmm. Mm-hmm. Thank you. So the next question goes back to Service Point, which we spoke about at the panel discussion that we had in January. Is Service Point only for homelessness? And if not, how flexibly can the data be manipulated?
So the good news is that Service Point is not only for homeless, and that the data can be manipulated pretty, there's a lot of opportunity for flexibility within Service Point. Service Point's a flexible, it's web-based tool, and it has many uses. In Lake County, around 30 human service organizations use it, and the homeless service providers are required to use it as a function of their funding, so there is very reliable use when it's required. But then there are also a lot of others who are using Service Point. We have really 4 primary uses of Service Point in the county. The one that is probably the most relevant to the broadest audience is the use that is the referral network. Mm-hmm. And so for that purpose, we've really, over time, been building and tweaking a use of Service Point that includes electronic referrals. So case managers being able to identify resources and send a client to that resource. And that's something that will be growing in the next year, and we will be inviting more partners to come and be able to participate in that, with the idea that this will bring down barriers for access to services. It will help case managers have good information about eligibility and where to send clients and where they can send clients. And then over time, we'll have better data about what people need but they're not getting, more data about why, why referrals are successful or not successful. So stay tuned. If you're interested, keep in touch with me, my colleague Eric Foote, about being able to join the referral network if that's something that sounds interesting. We have in the last year implemented places from housing authorities to youth organizations. We're talking to schools, health providers, all kinds of interested parties about how they can better participate in a better system of care, helping people get to the resources that are the most appropriate for them.
Mm-hmm. Mm-hmm. Great. I want to pause right now because it's a little after 10:30. Do a check-in with our participants and see if you all have any follow-up questions for our panelists. We are scheduled to go on for another half hour, so we've got a couple more questions for our panelists, and then we're going to open it up to you all to pose any questions that you may have, either from the event or from today's conversation. So again, please use that webinar chat feature that's at the bottom of your screens, and we'll continue to field those questions as we can. So let's move along. So Sean, also known as Scott, our next question is about behavioral and mental health issues, and how do those factor into understanding poverty? And what are some examples of creative strategies that you've seen that have successfully responded to those needs?
Sure. Many people with mental illness have symptoms that prevent them from working or working full time, which puts them at an economic disadvantage. And if they go on disability, their income puts them at or below poverty level. So their chances of actually trying to, survive or, make a decent living is very difficult because of the nature of their disability. Many with mental illness end up in the justice system also without any type of mental health assessment while they're in there. And a lot of times they get released and they go back out in society, and without any support, any counseling, any type of assessment being done, many end up right back in there. So it kind of continues to create this cycle. The criminal justice system and mental health services, they got to go hand in hand when adjusting mental illness. You have some communities that have as much as 25% of those in the criminal justice system suffer from some sort of mental illness, so it has to be addressed. I think the other thing too that I mentioned the goodwill as an example. I think those type of partnerships, are very important. But I think the biggest thing is making sure that their people are aware that they're out there, and being able to access that. Also, too, I think that just something else to kind of keep in mind. Brenda can probably speak to this a little bit better than I can, but if you drive around Lake County right now, and obviously in some of the most vulnerable neighborhoods or communities, and maybe not so vulnerable, the faces of the homeless has changed in Lake County as well. It's no more, the stereotypical type of what we think of someone as being homeless. Now you got minorities, but also you see Caucasians as well. The other thing too is families. We see people, we're driving into work to our place on here on Grand Avenue, and just up the street, you could see families literally out here in the cold. So it's changed. And, again, I've lived there my whole life, and I'm seeing a very different type of, situation here, what you're talking about, what the faces of homelessness look like in our county. The other thing too, I think to kind of keep in mind is, we need to think about the underhoused. And what I mean by that is, we have a lot of families who are living with other families. So although they got a roof over their head and a place to sleep or whatever, but actually they're really almost still kind of homeless in a way. I work a lot with kids. I'm a coach, outside of what I do at the health department. And I have a lot of kids on my team that I coach that are in those type of situations, and they're not even living with family members. They're living with friends, their friends' family. And, when they get tired of them, they got to find somewhere else to go. So this kind of goes back to our earlier discussion, especially when it comes to kids. But these are kids that are still in school. These are not individuals that are out of school and, old enough to, to be on their own or whatever. But yeah, I think kind of going back to the whole issue of mental health, mental illness, and poverty, it's a very difficult situation, and for a lot of people, they find a job, because of their disability, it may be very difficult for them to try and live on their own.
Sure.
This is Brenda. I just wanted to chime in really quickly. One of the things I think that I wanted to also add is there are behavioral health and mental health causes that will cause poverty, but there's also the mental health impacts of poverty, right? Like the levels of stress, the toxic stress, and that's the impact on children, the anxiety of constant worry about how am I going to feed my children and where am I going to stay tonight? Like the impact of physical illness. So I think we sometimes talk about how people have a serious mental illness and that's what causes them to be in this situation, but actually the impact of poverty on people is substantial in terms of mental health.
Mm-hmm. Mm-hmm. I think that really poses a difficult situation for families who may have a parent who's really dealing with behavioral or mental health issues and trying to take care of his or her children. That can be disastrous.
I really appreciate the conversation here. I think there's just a lot of really good insight, and both from Sean, I think Brenda, your point about the stress and anxiety and kind of broader impact on well-being that poverty has is really important. The researchers who think about scarcity talk about this a lot, and the kind of cognitive loads that not knowing how you're going to make ends meet create. I think it's really important, though, to underscore that while behavioral health and mental health issues are more prevalent among low-income families, the changes in the labor market are really driving a lot of the poverty we observe in our communities. And I know that the panelists aren't disagreeing with that, but I think I'm just particularly sensitive today to blaming everything around us on mental health issues. It's just the reality in our communities is that jobs don't pay as well as they used to, that if you don't have an advanced degree, it's much harder to find a good paying job, and that suburban labor markets have changed dramatically in the last 15 or 20 years in a way that folks who could get by perhaps 20 or 30 years ago without an advanced degree just struggle to. Work's more tenuous, it's less predictable, it doesn't pay as well, costs of living have outpaced wage growth for most people. These economic challenges are really critical, and we need to be mindful of how mental health and behavioral health come into play. But I don't want anyone kind of on board on this webinar to kind of walk away thinking that we're looking past the economic structural issues which constrain our communities. And I know nothing that Sean or Brenda or Jael have said kind of suggests that, but I think we should underscore that every chance we get.
Yes, thank you, Scott.
Yes.
Yeah, I just wanted to chime into this to talk about, talking about the creative strategies to respond to this. I think there's a huge need for mental health services in general. For the things that for the community that we serve, that's even more so, because bilingual counselors are basically non-existent. There's like maybe one or two in the whole county. Mm-hmm. So we've actually also started to form partnerships with different organizations to be able to provide services in this aspect. And then also some creative ways that we tried to come up with, it's like having health seminars or like group sessions, which basically, like, for example, our community health workers talking about this and telling people where there are resources. Mm-hmm. That's kind of like the way that we've also had to respond to the need, especially after all of the immigration changes that have occurred. We definitely saw a spike of the people calling in and asking for help because their kids were, under stress, not understanding what was going to happen, for example, with DACA. Families not understanding what the new immigration policies meant for them. So all of these changes really affects people every single day because they constantly live in fear of what their future will be. Mm-hmm. And definitely, that cannot be a good thing for anyone. So especially for communities who already don't have these resources. Right.
Yeah, and I think too, another creative strategy that we also have out here in Lake County is mental health first aid trainings, which are expanding awareness in the community regarding, getting people connected with support. So that's just another way we want to make sure that we can identify who's out there who are in need of support and get the support that they need.
Yes. And Sean, do you want to briefly speak to the work through Live Well Lake County and the mental health work group that's in place and the different strategies that group has employed?
They're kind of restructuring a little bit of that action team. But I just know that, it's definitely, this is a countywide, initiative that's it's a high priority. It's making sure that we kind of can get out there and make mental illness more of a focus for everybody in the community. So there's basically 3 areas of focus. That's like I just mentioned, the mental health first aid. Trying to get them, identified. And then there's also school-based work that's going on right now in the schools in Lake County. That's probably one of the most important ones. So, there's a few different areas. There's a few different things and areas that the action team is actually focusing on, and hopefully this can help address the issue in Lake County.
Great, thank you. So we now have about 15 minutes left for today's webinar, and what we'd like to do at this time, rather than move into the continued questions from last month's event, is allow the opportunity for you all to share questions. So our first question is coming from Chris Lopez. Chris, are you on the line? Chris, can you hear us? Okay, I'm not sure how we can, I think what we'll do is have Chris submit her question through the chat feature. So if you all have questions you'd like to ask, now is the time. We have about 10 minutes for question and answers from our participants. So please feel free to use the chat feature if you do have questions. If we don't, what we'll do is go back to the questions that we had posed from the audience and work through those. So maybe while we wait, I will pose one of the questions that we received from last month, which was about the shift in Lake County's population as it relates to leadership. Let me pull this up for you all. So with Lake County's population shifts, there's been a growing and maturing Latino community. Many institutional leaders are African American. What is being done or what can be done to open dialogues of race and diversity relative to shared needs and hopes, as well as tensions and challenges? Who would like to start?
Yeah, I'll go ahead and start. I think the main thing with this is, there's obviously a lot of cultural groups out there that's doing a lot of great work. But I think what helps is when we have the merging of memberships, so to speak, with a lot of these particular groups. So for instance, like the Latino Coalition, I've been to, several of their meetings, and, I see African American, I see Caucasian, I see people of different cultures that are there. Same with the NAACP, faith community, churches, a lot of community-based organizations. So I think there needs to be a merging of membership, or allow, I should say, other people who are obviously concerned about some of the same issues that, these groups are concerned about. And I think the one thing we have to do is kind of not be territorial in that way with these groups, and kind of allow, for people who have the same mindset to come in and help. The other thing too, I think, is we can't allow voices basically to pit one minority group against the other. That seems to be, kind of our discussion in our society today. And, but all communities must, come together, work as a collective group, and this can only be done through strategic and compassionate dialogue. So, yeah.
Thank you, Sean. This is Brenda. I wanted to take the question a different way, continuing my theme as data guru, to at least talk about the, on the community development website, we do have the Lake County Analysis of Impediments to Fair Housing Choice. And that is a report that was commissioned in, from a Applied Real Estate Analysis, is the name of the firm that helps us compile this report. And it really digs into data on areas of diversity, including race, ethnicity, disability, religion, and really its impact on housing. In that report, there are action step recommendations for ways that we can better educate about issues around housing and equity, and also address some of the structural issues. So I wanted to make sure to point that out. And also, one of the ways that we're working in community development is that as a funder, we have specific goals that relate to this area. So we have a goal in our strategic plan that's creating welcoming communities, and we fund projects that help advance conversations around being more inclusive. And again, working to put affordable housing in areas throughout the county, especially high opportunity areas, is another way to address the structural areas that we see disproportionate impact in our community.
Mm-hmm. Mm-hmm. Yeah, and just to chime in, I definitely agree with Sean when he mentioned that, not to be territorial, right? Because there are very few Latino leaders in the communities, even if a certain community is largely populated by Latino community members. So this is definitely something that we have to address in all communities of color. But like you say, there's this tendency of competition for resources between Black and brown communities or something like that. And so this doesn't allow us to focus on big picture issues. And I think that we need to have more open conversation between both communities of color to be able to, find a common ground and support each other. Because like you mentioned, Sean, we a lot of times have the same issue that we're addressing, but we, don't necessarily identify it right away. So I think it's definitely important that in positions of leadership across the county, either public and private sector, that we do make it a point to seek out these diverse candidates to fill specific ranks. That leadership, actively seeks to hire candidates who are reflective of the community demographics and leadership levels as well. But I think one of the most important things that we need to highlight is that this issue with having more diverse leaders is not something that just the Black and brown communities can solve, or the minority community can solve. It's something that we need allies. We need people for everyone to be a part of this change, and it's just important that we have these allies who can actually raise this issue and work with communities of color to build these leaders. Right. And so I think that that's something that we really need to remember, right? Just like the greatest example of domestic violence, right? It's not something only women can solve. It's something that men have to be a part of in order to change this culture. So it's the same thing.
Yeah.
Exactly. And I agree.
Yep.
Thank you. So we have a question from our participants. Julia asks about the issue of lack of transportation. It seems to be a common thread. Are there any creative ideas to address this issue in Lake County? I have one idea. I don't know. Does anybody from the panel want to speak first? Well, I can start. So. Julia, in response to your question, I do know that the Lake County Center for Independent Living, which is located in Mundelein, has been spearheading a task force called the Lake County Transportation Service Coalition, I believe, quite a mouthful. And they've looked at how they can effectively map services to connect different regions of the community. So if you take Lake County and divide it into 4 areas, oftentimes you'll find that public transportation lines are effective for a particular branch of Lake County. What that group has been trying to do in partnership with several other members, community partners, and other municipalities is kind of break down those invisible kind of transportation walls so that people can get from point A to point Z much more seamlessly if they have appointments across the county. This has been something that the Community Foundation worked in briefly a few years ago. We recognize that this takes extensive amounts of work and a significant amount of funding to impact access to transportation. And I think it's an issue that we're seeing a lot of our nonprofit partners in the community coming up with different creative ways to address it for the populations that they serve. But in terms of a comprehensive transportation service strategy, I think that's something that's yet to be created. Do any of you have specific examples of how your organizations are connecting people to access to transportation and resources?
I'm so worried I'm going to get this wrong. This is Brenda. I'm trying to search my inbox. So I know transportation frequently comes up when we do surveys of the community about barriers, barriers to employment and housing, and just that in Chicago we know that we have this wheel and spoke transportation system that gets people to Chicago pretty effectively, but doesn't get people across the county effectively. And there's work being done on it. I received a survey this week. This is a part of a study that's going on right now. I know that the Department of Transportation is involved. I know that, so maybe I can include that as a part of the toolkit if people are interested in participating in that survey. And I'm sorry that I'm not getting the acronym right and the names right, but I know that there is some work being done on that about how do we with limited resources, help address some of those transportation barriers, especially for people with disabilities. And then there's like a fragmented system response, like townships provide response.
Yeah.
Great community organizations do various things, but trying to get that coordinated and easier to understand to the public is something that people are working on right now.
One of the things that I see, I know it exists in Lake County and in other counties in the Chicago region, and you see it in other places, are programs that actually help low-income families repair and fix their cars. It sounds kind of simple, but you know, a lot of families share a car or have access to a car, which is really critical in suburban areas for the reasons that have been laid out. But the cars don't work very well; they're not predictable, and actually, it's a pretty easy, low-hanging fruit kind of set of solutions to help folks just improve how their cars work. They can't afford to do it, but the return on investment is huge. I know I've seen this in some crowdsourcing work that I've been connected to in Chicago, where we've helped crowdsource repairs for cars and other things. It really matters, and it kind of, again, you know, it's hard maybe to implement or execute, but that's an easy step that you could scale with some creativity and some funding.
Yeah, that's a great idea. I love that. Brenda just mentioned that she's seen that model successfully implemented in the Milwaukee area as well. So I think there's definitely a lot of local learning that could take place around that to bring something like that to our community. I know our PACE bus system also has implemented a rideshare program, which I think there's different facets of the rideshare program. So individuals can opt into a rideshare to enable them to get to work or to doctor's appointments. And then there's also a program that's offered through them as well, where an individual is, and I'm not exactly sure of the parameters, but we can share that in the toolbox, where people opt in to be the driver of the rideshare, and so that vehicle is housed wherever they live, and then they're able to provide transportation services using that vehicle. Of course, there's parameters around that as well. So we are getting ready to near the end of today's webinar. Megan, I see your fantastic question, and we'll be sure to address that through Scott. Please note that those of you who did pose questions, if we weren't able to get to those today, we will address those in follow-up to you all. Lastly, I just want to take the last couple of minutes and share our contact information again. We will share this slide deck with each of you following the event, and you also have access to our staff contact information, which is listed on this last slide. Thank you all so much for participating in today's first webinar. We hope that this will be just one of several others. And special thanks to all of our panelists for joining us once again. Thank you to Brenda, Jael, Sean, and Scott. Their contact information is going to be shared as well. So if you have specific questions that you'd like to follow up with them on, please do so. Again, a recording of this is going to be shared in a few days. And lastly, we invite you to connect with us. There's links on the last slide here for Facebook, LinkedIn, and our website. You can contact any of our team, Maya, myself, and Wendy, if you have feedback or suggestions for future webinars. As Brenda shared, we will be following up with a toolkit from our event, and we'll include some of the resources that we mentioned in today's session, as well as items that were mentioned in last month's discussion. So once again, thank you all so much for your participation. We hope that this was a valuable and productive discussion, and we wish you all a great weekend. Thank you.
Thank you.
Thank you for having me. Thank you. Bye.
Bye, everyone.